and we'll see who's in the dance studio over there. It's a little bit early. I started a little bit early. Been really enjoying the summer coming. It's been gray, but we had a lot of rain and things are kind of beautiful out here. I'm hoping that you're all looking forward to a wonderful spring and summer. I know our summer. I guess I'm certainly looking forward to the summer. We've been doing very well here. Today, I'm just really going to leave this open to everyone to ask questions. And hi, Amber. It's good to see you. Sarah, good to see you, my dear. That's on the Facebook side of things. Today is a question and answer, so we're going to be pretty all over the place here. Not a lot of new stuff that I can think of that's in the news in terms of fertility. But I'm always open to questions that are just curious. Of course. Hi, Paula. Paula Hilton. How many embryos would a 38-year-old need for one live birth? If you do genetically tested embryos, 3 chromosomally normal embryos it will give you a better than 80% chance of achieving a pregnancy. Hey, Nathalie. Good to see you, my dear Lee Dora. Hi, De Munoz. Hello, when is a good time after a failed IVF transfer to try again? Well, on D, I would ask your doctor to kind of look at to basically look at your stimulation, look at your history, and make sure there might not be something you might want to fix before you do another transfer. But you could do a back-to-back transfer, no problem. MG, do you suggest ERA for someone that is going for their first transfer? No, I do not. I think of the ERA as a way for you to hone in a little bit. I think there's an overthought on the role that the ERA plays. It helps about 25% of the 70% that aren't successful, or 60% that aren't successful on the first try, or have had repeated failures. It's not fixing anything, it's really honing something. Today I am 5 days post day 3 transfer. I had my labs done today and my E2 is 1200. Is that good? Yes, that's fine. It just suggests that you've got lots of estrogen on board, not too much. Giselle, hello, Giselle. Nikki, hi, good to see you. Leodora, I said hi. I guess most folks jump over to Facebook, but if I can answer any questions on Instagram also. Olivia, I'm fixing to turn 32. I have PCOS, 3 miscarriages, no live birth. Been trying with my husband for 9 years. Well, I think the 9 years have told you everything you need to know. Check the eggs, check the sperm, check the uterus, check the fallopian tube, check your hormones, check your thyroid, check your prolactin, do acupuncture, do the keto. These are things, but you need 3 miscarriages. That's called recurrent pregnancy loss. Amber, my last transfer second, enter with chemical, doing an ERA this cycle. Would you suggest anything else before our next transfer? Well, I know, Amber, you're doing a lot. I can't think of anything in particular, except, of course, you're doing acupuncture, serovital, all those great things. It was a chemical pregnancy. The ERA is really going to give us a timing, but that's a tough one to answer just on the live here. Would you recommend for a person that has 2 ectopic pregnancies with tube removed? Of course, Amaryllis, it's IVF, in vitro fertilization. Now the C-naltrexone HCl 3 milligrams, the same as low-dose naltrexone. I don't know that particular designation, but you certainly can go online and look that up on Google. Nikki, male factor question. Husband has low testosterone and a low count. What would you recommend? Shots to help boost it, or molecular fertility male essential and fish oil? Okay. Nikki, they're all mixed up in here. Low testosterone, low sperm count are help with Clomid. You could do Clomid or letrozole. Clomid has the most history, HCG. The male fertility essential is not going to change the count. It just is like the octane in the gas. It's not the gas itself. Melissa, so I was told I would only need to take something from my period to make it appear when I'm ready for a transfer. Wouldn't it be better to try it before then? Okay. Okay, Melissa. Its appearance when I'm ready for transfer. I guess, Melissa, I lost your question. My pleasure, Amber. Sarah, Beth, 30 years old, no established fertility issues. Husband is 45 with vasectomy. Do you recommend PGT? No, I really don't. The best data we have is between 35 and 38. That's kind of the best sweet spot for PGTA, but really it's not that advantageous if you're looking at all of the embryos you make. Jeanette, what transfer meds do we start the first night? I'm flying to Albany for baseline and I'm wondering if I need to take my meds with me. What transfer med? Well, you have the estrogen and progesterone and baby aspirin. You should have your meds with you. Heather, how soon after polypectomy can I start IVF? I always say 6 weeks. Yeah, I would say 6 weeks. Hello, Kaylin Puffer. Good to see you, my dear. Would it be better to try and get a period before a frozen embryo transfer? You should have a regular menstrual cycle prior to doing a frozen embryo cycle, because you don't want, especially if it's after a retrieval, because you want to make sure that the lining is kind of rejuvenated itself. To see if the lining is going to be an issue. Well, they're going to watch you when you're doing your frozen embryo transfer. They will watch and monitor your lining to make sure that it's trilamina, because trilamina is what you want to see. Okay, that's really what you want to see. Hey, Amber Kelly Martin, my dear daughter, good to see you. Hello, sweetheart. All righty. Slow questions today. I guess since I didn't have a topic, we have everybody's smart now. You guys don't need me anymore. You know everything. So what kind of things can we talk about? Well, we talked a little bit about the ERA, the endometrial receptivity assay. There are two companies, iGenomics and Cooper Genomics, and they both make a good product. It essentially looks at the timing of progesterone. It does not look at how much progesterone, by the way. Claudine Barron. Hi, doctor. How does priming with birth control pills for 2 weeks affect IVF count? Well, again, I don't understand where everyone's getting this priming. Priming, it's not the right word. It's scheduling, but the priming is really estrogen. Estrogen priming was for postmenopausal women. That's where the terminology came from. How can we up our Melissa Lugo Hardly? Would it be better to try and get a period before frozen? Hardly going to be an issue. I don't know. Jennifer, how can we get our follicle? How can we up our follicle count? Well, a follicle count is basically a representation of your body's number of eggs available, or follicles containing eggs in your ovary, and that's a function of your X chromosome, especially from your mom. Things like Hashimoto's thyroiditis can reduce that number. Surgeries can reduce that number. Endometriosis can reduce that number. So toxins like chemotherapy can reduce that number, but you can't increase that number. How can you up your AMH level? Again, same thing, Deirdre. It's a representation of the follicles that are active. So acupuncture, improving blood flow, reducing resistance in the arteries by a low-carb diet to get rid of the atherosclerosis. These are things that might improve blood flow, which might change your AMH level a little bit. Acupuncture being the best. Tabitha, is it common for FSH to fluctuate cycle to cycle? Yes. How can I prevent big fluctuation from 7 to 16? Well, the 16 is the real number probably, Tabitha. Again, maybe Tabitha, give me your age and I can kind of give you an idea, but you can't do anything to change. Think of it as a thermometer. A thermometer is nothing more than a reflection of the temperature of a surface or a liquid. It doesn't change the liquid at all when you put a thermometer in it. And if you break the thermometer and make it read high, or break the thermometer and make it read low, it's still the temperature of the water or the temperature of the surface is the same. Is it better to do an egg retrieval before or after an excision surgery? Absolutely. It's better to do IVF before your surgery. Anytime you do, oh, that's another reason why you'd have low egg count is surgery can sometimes do that. So you want to make sure you get the eggs out before you do anything to possibly damage the blood flow or to damage the ovary itself. Sarah, what are the chances sperm from a test PISA would be viable without repeating procedures during retrieval? Well, I'm assuming it's frozen. It should be okay. My first IVF is coming at the end of the month. I'm 35, pieces 4.5. Can I go back-to-back stim cycles? Sure you can. But you should get a good response, Brandy. Christy O'Neill, if I call tomorrow for cycle day one, will I be on a waiting list? I don't know where you're calling, Christy. And waiting list for what? For IVF, for testing? Maritza, what is the ideal endometrial thickness? I did a whole talk on that. Go back in the archives. I did a whole thing on the lining. The numbers range from 6 to 16 actually are fine. What is the idea? Okay, is C naltrexone ACE the same? Yes, that must be the low dose naltrexone. It's just another. It's the low dose naltrexone is a description. The C naltrexone HCl is actually the actual drug. I thought I was getting LDN and Omnitrope, but I received Omnitrope. Yeah. There's no such thing as LDN. That's LDN is a general term for that drug. So you should be fine, but talk to the nurses. Paula, I'm 38 AMH of 0.6, first egg retrieval, 3 eggs, all fertilized, 1 fresh, 3 second egg retrieval, 7 eggs. Wow, nice. Transferred to finish. Should I, in the future, push to blasts? You're 38. No, I think a day 3 transfer is fine. Now, the blast will tell you who is more likely to be successful, but an embryo in the uterus is always more likely to be successful than an embryo not in the uterus. Michaela, I am getting so excited for my FET with you soon. Just waiting for cycle to call, and I've been adding Lovenox and Neupogen, ACG wash, and Intraluz. Wow, let's make it work, Michaela. Let's make it work. Clarabelle, please fix the phone that's never answered. Well, actually, it is answered, but it usually takes about an hour. I used to say we get 3,000 phone calls a day, but I think it's 5,000 phone calls a day. So yes, but in your case, Clarabelle, what I would strongly recommend is use the portal. Use the portal. Christy O'Neill, a waiting list for Colorado. Well, there's a waiting. I think what you mean by we have a certain number of cycles we do each day, and I think we get filled up pretty quickly, to be honest with you. So it may well be there may well be a waiting list. I actually don't know. Samantha Nathel, oh boy. Okay, Melanie, diagnosed premature ovarian failure, tried Menopur with no growth. Would donor eggs be best option? Yes, of course, Melanie. The key issue here is you need lots and lots of eggs to make things work. And donor eggs, of course, are from younger women with lots and lots of eggs. So the logic there is the eggs are more likely to succeed. So making a baby, that's important. So donor eggs are fine. Do you recommend a day 3 or day 5 transfer for a 43-year-old? I'm really liking the idea of day 3 transfers, to tell you the truth. Samantha Teehee, I have my consult on June 5th, I think. How soon should we expect to get started for meds? Consults on June 5th. What meds? What consult? Is this a new patient consult, Samantha? If it's a new patient consult, you do the consult on that day. We figure out what you need. 2 weeks later, you'll be contacted by financial. Then you get in touch with the clinical team about 2 weeks after that. You get your testing done. After all the testing done, and then you get into a cycle. Heather, should I take Omnitrope and Serovital at the same time? Absolutely. 2 different mechanisms. And I like them both. So Heather, yes, both. Christy, okay, great. Thanks, Christy. Samantha, started meds yesterday for first frozen. Is there anything extra I can do to help my body prepare for transfer and help my baby stick? My 9 embryos are all day 5. Wow, Samantha. So IVF, I'm sorry, acupuncture. traditional Chinese medicine. Do a low-carb diet. Take all the vitamins that we recommend. Keep yourself well hydrated. Get rest. Avoid alcohol, tobacco, drugs. Do not be around anyone who smokes or vapes or marijuana or anything else like that. Remember, 50% of miscarriages are caused by the partner, the effect of smoking, alcohol, and stuff on the partner. Christiane Martinez. We just had a beautiful baby girl a month ago. We transferred. Oh, God bless you. Thanks so much for everything. We have one egg left. How long after birth do you recommend the second IVF pregnancy? Well, you know, breastfeeding, you said you had a baby 1 month ago. So I would say at least 12 to 18 months. Yes, new patient. Sorry, Samantha. Okay. We have an issue with me ovulating, and he's having an issue with motility and morphology. Yeah, so yeah, we can certainly modulate. The point of it is, I guess, Samantha T, is that there is a process, and the process takes about 4 to 6 weeks when you're first introduced to you guys to get you into any kind of a treatment plan, at least 4 to 6 weeks, and that's just simply for the testing and menstrual cycle. Melanie, if I did testing in December, would I need new testing for my consult in July? No, Melanie, the thing, we don't do that. If you have something within a year, and it's really reasonable information, now, granted, if something has changed, of course we want to check and improve your outcomes. I mean, our goal is always, how can we improve your outcome? And so if there's something we need to learn, we will, but no, we're not the kind of a practice which says you have to repeat all the tests because we said so. That's just not us. Yeah, that's just not us. So let's see. No more questions here. It's a quiet night, folks. Anything you'd like me to talk about? Any topics you'd like me to talk about? I mean, I'm happy to answer questions. Let's see. Can elevated thyroid, TSH, cause issues with pregnancy? Absolutely, Maritza. If it's elevated, it means that your thyroid is not producing enough thyroid hormone. So TSH comes from the brain, and it tells the thyroid to produce thyroid thyroxine, T4, and triiodothyronine, T3. And so when a TSH is elevated, it means the body's working extra hard to try to find an egg. Well, I'm sorry, it means the body's working extra hard to try to get your thyroid to produce enough thyroid hormone. And that causes stress on the system. So absolutely, you want to get yourself on thyroid medication. Does removing the scar tissue via laparoscopy increase implant? Okay, via lapo. Does removing scar tissue, let's say hysteroscopy, because that's how you would do it inside the uterus, it should. Deidre, already have HSG, have all these labs done, all the tests needed before the new patient consult in July. Well, eggs, sperm, uterus, and fallopian tubes, thyroid hormone, hepatitis, ABC, HIV, syphilis, CBC, metabolic profile, there you go. Michaela, what are your favorite places to eat in Colorado Springs? Well, that's easy. Any place that has a steak. So Cowboy Star is a wonderful place. Wonderful place. Tell them Dr. Magarelli sent you. Carlos's Bistro if you want a really international flair. Prime 25, which is another fantastic steakhouse. It's fun. Fratarelli's if you like Italian food. Absolutely. Gosh, I can go on and on. Can you take Serovital at the same time as Synthroid? Absolutely. Heather. Deanne, I'm having a polyp removed Friday. I don't know the rest of the sentence. Melanie, I'm also on hormone replacement therapy. Do I stay on therapy? So I stay on that, or would you need to stop around the time we figure a plan? No, stay on it. Stay on it for now. Christy, is there a number or link on the website to order Omnitrope and Serovital for preparing for? I'm just about out of my supplements. No, just portal the nurses. Portal the nurses. Whoever you've been working with, Christy, portal the nurses directly. Janet Gallegos, going in for a diagnostic blood work and ultrasound on Friday. What should I expect after that? Sorry if you already answered this. No problems, Janet. So no, you're going to get blood work and an ultrasound. That's called your baseline. That's pretty much it for that visit. And then, depending on whether or not you get the sperm, whether or not you need to have your uterus and fallopian tubes set up, then they'll set those appointments. Then when all the results are back, you could either have a consult with a doctor, or you may have already had a consult, and then you go from there. Janet, oh, that's what I just said. Beth, I'm waiting my consult. I started taking Serovital, prenatals, CoQ10, vitamin D, B12. Anything else I should start to be prepared? Let's see. Folic acid, prenatal vitamins. Those are pretty important. Hope you're taking methylated B vitamins. Vitamin C is excellent, very inexpensive. Let's see. Serovital, prenatals, CoQ10. A fish oil. That would be good. Okay, what percentage chance do you have of implanting one egg through transfer of an egg taking, and what can improve that? No fertility issues just now for the uterus. My sister is having the procedure for me with my egg. What percentage chance? Well, it has to determine, Danielle, about how old you are and your AMH. That determines the success rate. Just not with the uterus. My sister is having the procedure. Yeah, I need to know how old you are, Danielle, and transfer, implanting one egg through transfer of one egg. And if it's a genetically tested embryo, that's important. And you're 30. So if it's not genetically tested, it's about a 30% chance, a little less than that, 20 to 30%. If it is chromosomally tested, then it's probably 40 to 50% chance. Christy, my last COVID vaccine shot will be June 3rd. How long do we recommend waiting for egg IVF retrieval? Probably, I think 4 weeks is fine. It's the transfer we worry about. We want you to wait at least a month after your shot before you even consider a transfer, okay? That's really where we worry about it mostly. All right, let me have a little bit of water here. Do you suggest PGTA testing, Deidre? Deidre, in a way I do and in a way I don't. If you have a chromosome abnormality that runs in your family, of course, do it. If you want a boy or girl, of course, that's the best way in the US to get it. If it's simply you want to increase your odds of a particular transfer working, yeah, it'll work. But the fact of the matter is, as long as you put in all the embryos that you originally made, you're more likely to have a baby without testing. Some folks think that it gets you faster to a pregnancy, but it also runs into what we call embryo wastage. Because of all the procedures that you're going through, it could lose one embryo here, one embryo there, one embryo there. So it may not be as great as we originally thought. Do you recommend genetic testing on donor egg IVF? No, not necessarily, for the reason I was just mentioning. Lidora, currently have my second cycle this month. I don't know what that symbol is. Generally ranges 28 to 42 days. I want to do an egg retrieval in June, but I'm not sure when I should order my meds. Okay, June is less than 2 weeks away, so I would really get on the stick and get that ordered. Maritza, is there an increase in the transfer of mosaic? Is there an increase in the transfer of mosaic embryos? Okay. PBS had a great documentary on IVF. Now, is there an increased miscarriage rate, Maritza? Hey, Mary, nice to see you. Yes. If the embryo is mosaic, you have a slightly higher chance of a miscarriage and a lower chance of implantation versus a normal embryo. Silvana, I want to do a natural IVF with no stim meds. I don't want to use more medications and want a chance of conceiving with my egg my body naturally produces. Do you or any RA perform these procedures? Yes, we do. Yes, we do. I'm 5 days post IUI number 7, and I'm very bloated. It's the first time I've had 4 mature follicles. Can this explain the bloating? Yes. And acupuncture can help with the bloating. Increased protein can help with the bloating. Increased protein consumption can help with the bloating. I'm just surprised that you're doing an IUI with 4 mature follicles, because you could get hyperstimulation, so be cautious. So keep your protein up, see your acupuncturist. That's what I would strongly recommend. Okay, Christy, I'm not sure what that means. Melissa, I am 35. I've had 3 failed transfers. Would you recommend that in this transfer there are 2 embryos? Well, Melissa, I'm assuming these are untested embryos, and you've been doing 1 at a time. You certainly can. Melissa, you're welcome. 2 Melissas, Grown and Jazar. Yes, I think it's not unreasonable, but I would also ask to maybe do an endometrial receptivity assay to see why you have a failed transfer. Maybe the timing is off. So before you put your beautiful embryo in there, I would probably want to do that. Will CNY, Beth, transfer low mosaic embryos? Absolutely, they're your embryos, and certainly there's babies being born. Now, by the way, folks, mosaic embryos, you may not know what we're talking about. When you get a report today from your genetics, your pre-implantation genetic testing, PGT, it'll say euploid, which means you meaning normal, aneuploid meaning abnormal, low-level mosaic mean some cells normal, few cells, no, some cells normal, few cells abnormal. So that's low level. Then high level is most cells abnormal, some cells normal. And in all those cases, including the aneuploid, some folks have gotten a pregnancy to go to term. Very rarely on the low level, high level, or the aneuploid, but it's possible. So we at CNY feel like these are your embryos. You have the right to make a choice as to what you do, because for many decades, we did embryo transfers with low levels aneuploids because we didn't have genetic testing. We just put them in. So that's the best answer there. Letting people know you're on Facebook Live. Oh, thank you, Christy. Okay, thank you. Brandy, would it be beneficial to schedule acupuncture before each egg retrieval monitoring appointment? If you can, that would be great, but it has nothing to do with the monitoring appointment. It simply has to do with repeated acupuncture therapy. We've proven, this is Dr. Credenda and I, Dr. Credenda is the doc who I worked with for the East Winds Acupuncture, and we developed the Credenda Magarelli Acupuncture Protocol. But we have found that 9 treatments is kind of the sweet spot for the best threshold for having a response. You could do more than 9, but before 9, it's not as good as 9 or more. So if you can schedule them out, maybe twice a week for 4 to 6 weeks, that would be fantastic. If you could do it after, certain protocols are useful after, and so that's certainly something you can do. So I hope I answered your question. Sartre calculated my odds of success for IVF to be 15% each cycle, Heather. I have 1 point and age 40, grappling with doing IUI. Holy mackerel. So this is I think that's a super good number, 15%, Heather, okay? So Heather, let's talk about biology of reproduction very shortly. As a 20-year-old, you have a 20% chance of getting pregnant each month at your age 20 with sex. By 30, you have a 10% chance of getting pregnant each month with sex. By 40, you have a 4% chance of getting pregnant with sex. So if someone says to you, you're 40 and I give you a 15% chance, by the way, you never can be 15% pregnant. You're either 0 or 100. IUI, for example, in your case, would be a 1% chance of success, given your age, maybe 2. So, you know what I mean? So IVF would probably be that 15%. IVF with chromosomally tested embryos would be closer to 40 or 50%. So Heather, you kind of that calculator is interesting, and it's odds. It's odds of pregnancy, but remember, you're not a statistic. Every human has a 0 or 100% chance of success. So it's how soon you get there is what that odd is telling you. So if you're doing an IUI and you have a 1% chance, it should take 99 cycles to get pregnant, right? If you have a 40% chance, it should take 3 cycles to get pregnant. Randy, if I did 9 treatments 9 days in a row, or do they have to be spread out to be effective? We don't know the answer to that, but I think twice per week. I think sometimes people can get up to 3 per week, but anything you do is going to help. Now, if this is before retrieval, remember there's two parts to the acupuncture protocol. One part is to help with the retrieval side, blood flow. The other one is for the transfer side, uterine quiescence, or quieting the uterus prior to transfer. Melanie, he stated yes. Maritza, he stated yes. What was his reply? He stated yes. Okay. Melanie, I'm traveling to Colorado from New Mexico for donor egg IVF. About how many appointments would I need? I know everybody's different. Just 4 or 5. Probably 4 or 5. All righty. So I know everyone's different, just wondering. So I'm traveling to Colorado from New Mexico for donor egg. No, probably 2 visits, maybe 3 visits. Yeah, because the donor egg IVF means that someone is making an embryo for you, right? So one time go up, drop off your husband's sperm, or I don't know how you're doing it, then fertilize the eggs, grow the embryos, and then, probably day 5 transfer. So then you can either stay up for about 4 or 5 days or just drop off the sperm and then come back and then I think they do frozen embryo transfers. So probably 3 total visits. That's probably what it will take. All right. Must be really pretty out because it is actually really pretty out. We finally got blue skies. We had quite a thunderstorm today. But it's absolutely gorgeous out there. All our trees are blooming. I'll have to flip this around one of these days. You can see the backyard here instead of my little house here. Okay, can you give me contact info for an acupuncturist who has the protocol? Of course, Monica. www.aborm.org, the American Board of Oriental Reproductive Medicine, www.aborm.org. If you live in New York near Syracuse or Albany, then they have the Healing Arts Centers that are actually there on site. Here in Colorado, East Winds Acupuncture in Colorado Springs is our preferred provider. That's Dr. Credenda and Dr. King. But the ABORM are board certified acupuncturists. So they have did extra training, a certification. So it's a good place to start if you're not in New York or you're not in Colorado here. Well, even if you're in Colorado, it'll work. What do you recommend for morning sickness? I'm nothing. That's not my area. But I would talk to your acupuncturist. Is your choice for CNY? I won't recommend using. Okay, it's your choice, but CNY won't recommend using low limits due to the high chance of lack of implantation. No, Mary, that's not true. It's not. We don't recommend or not recommend low-level mosaics. We just don't recommend them because it's patients are coming to us for one healthy baby, right? I mean, that's what they're coming. But if they want to use their embryos and take the chance that maybe the baby will be successful and maybe it may not be, then that we believe is, something you have the right to do. Obushi, I'm in my late 40s. I've had 6 failed IVFs. In the process trying again, what's my chance of success? Late 40s. I don't know. Give me a number. What is a late 40? C-bands, acupressure. Thank you, Brandy. Martha, I'm sure the question was asked before, but what are your thoughts about the COVID vaccine? Absolutely. Everyone should get the COVID vaccine, period. Males should get the COVID vaccine. Lactating mothers should get the COVID vaccine. Pregnant women should get the COVID vaccine. Reproductive women always should get the COVID vaccine. So at 49, your chance of using your own egg is probably less than 1% success per IVF treatment. So somewhere in the maybe 1% chance. Mimi, I have a 2-centimeter ovarian cyst and a 3-centimeter subserosal fibroid. Okay, doing mini IVF just started priming. Can Omnitrope cause a cyst or the fibroid to grow? Not likely. Do you recommend an ultrasound during priming? No, not in particular. Maritza, is 4 to 5 days for donor egg retrieval and fresh transfer. My sister is my donor egg and we want to do a fresh transfer. I'm not sure we do fresh transfers, Maritza, on a donor egg cycle. I think we make the eggs, create the embryos, and then you come back later for the transfer. Yeah, I don't do, because of the timing of trying to coordinate two people, those are usually separated. That's my understanding is what CNY does. But if you know better than I, that's fine. But no, it's two separate times. It's not the same cycle. Yeah, it's not the same cycle. Typically, it's not the same cycle. All right, he's fortified. Okay. Other questions? How many folks on that Instagram side? It's getting less and less, but if you do come on, I'm here. If you have any questions, don't hesitate to ask. But we like this Facebook and YouTube side. It's kind of all encompassing. It's really nice. Any more questions? Here we go. How are you feeling today, Doc? Thank you. I'm feeling tired. To be honest with you, tired. I am. Thank you, Elaine. Isabel, Dr. Magdalene, I took Neupogen, up until 15 weeks, and I'm 17 weeks since I stopped. I've had knee and upper arm pain like joint pain. Is this normal? I would have no idea. I do not know much about Neupogen. Olubishi, all cycles were with donor eggs. Got it. So we have to find out why you're not implanting. So it's not the donor egg, Olubishi. That's what we have to find out. So Isabella, you may want to call the nurses or look online if that's so. Since it's an anti-inflammatory, it may well be that getting off it, it brought back your aches and pains. Sarah, so I'm choosing IVF due to having my tubes tied. What meds would I need? There are about 15. You can go to our, actually you can download our family building guide at www.cnyfertility.com. Thank you, Michaela. Thank you. So go to www.cnyfertility.com and go to the resource page and download our family building guide. You can find books by Dr. Kills on Amazon. So that's another resource. But we have so much resource material on our resource page at CNY. I really think since it's free, it's there. I would recommend going there and downloading it and reading it because it'll tell you about the gonadotropins and it'll tell you about the GnRH agonists and antagonists. It'll tell you about the progesterone. It'll tell you about the estrogen and the growth hormone and the various immune stuff. Myra, what's my chance at 42 with an AMH of 0.4 of achieving a pregnancy with basic IVF is about maybe a 5 or 10% chance with chromosomally tested embryos. And if you can get 2 chromosomally tested embryos, you're probably closer to a 35% chance. Lee, what other recommendations would you recommend after 3 fails with tested normal PGTA? You know, Lee, I think ERA would be certainly something I would do, the endometrial receptivity assay. Endometriosis, definitely get laparoscopy. Again, another patient today, very confusing history, didn't know why she was getting pregnant. They did a surgical procedure on her and found grade 3 endometriosis. Wow, it was hidden. So definitely laparoscopy to see if you have endometriosis. Michael hi there. Is there a certain grade with eggs that you do not transfer? The embryo grading is a arbitrary, subjective beauty contest. Sometimes it correlates with success. Most times it doesn't correlate with success. So really, I'm not a grade person. If it's alive and it has a chance of sticking, good to go. H.A. Quattlebaum. If a man had a successful teaser, would that indicate an aspiration would be doable? Yes. Yes. Typically, H.A. Typically, that would be. So, Myra, so donor egg is an option. Absolutely, Myra. In that case, that would be a 30% with basic IVF and about a 60% with chromosomally tested embryos. Consult is this week. Will it be possible to start a cycle this summer? Of course. Husband is a teacher. Yes, summer meaning July or August, right, Jenny? Jessica, I've read that for IVF, at least 10 eggs need to be retrieved for success for women with diminished ovarian reserve. Have you ever seen success with someone who produced less than 10? Of course. Jessica, everyone, one egg, one embryo, one baby. Those statistics are for populations. They're not, they're just for comparisons and for calculations. But remember, well, if you make an egg, make an embryo, you have a 100% chance of being successful or 0. Michael, thank you. Looking forward to that. Okay. All righty. I read that. Okay. So, Deanna, after having a polyp removed, when you can return to normal activities? 3 to 5 days. And then, but 4 to 6 weeks, you'll be tired. Can you do an ERA and a labs together? I'm assuming so. Deidre, how soon after my consultation would I be able to do IVF? I already have the financial side saved. Usually 4 to 6 weeks is the process of kind of getting everything together. So it'll be 2 weeks after your consult. You'll be contacted with the financial person. Then you'll call us. Remember, after that first call from financial, it's up to you guys to contact us through the portal, not phones. Like the lady said, she's on the phone forever. No one answers. It's important that you stay on top of your care, okay? Testing done as well, absolutely. You're very welcome, Jessica. Just got a text from Dr. Kiltz. He's doing fine. He's just about to go out to dinner, which is have a good dinner, Dr. Kiltz. You're welcome, Deidre. You're welcome. I mean, can you do ERA and laparoscopy in the same cycle? Yeah, I think you can. Absolutely, you should be able to. No problem. Yeah, I don't see that as a problem, Lee Long. Let's see, where's my phone? I'll just tell him, I'll tell Dr. Kills to enjoy himself here. I'll just wave to him here so he'll know that I'm working while he's going out to dinner there. Let's get rid of that. There we go. All right, I'm going to tell him to enjoy himself. All righty. Price range for doing IVF with a donor? No idea, Myra. Just go to our website. All of the information is there. It's in writing. It depends on a lot of factors. So, yeah, I don't talk money. That's kind of a financial thing. Yeah, it's better for them. It's better for other folks to talk the financial side. I do enough. I have to learn enough just to do the medical side, but to try to figure out the financial side, that's a little bit challenging. All right. Oh, let's see what else is going on here. Quiet today, you guys. We got 37 people online, but we have the same 10 people asking questions. Don't you guys have any questions? You can ask about any aspect of the process. By the way, I am going to be doing I think in the next 2 to 3 weeks, a whole Facebook Live on LGBT community and fertility options in the LGBTQ community. I'm going to be answering questions about that. I'll have, as you know, I like to do little presentations, so I'll pull up some data on reciprocal IVF, on egg freezing, on male-male as well as female-female couples, the options that they have, single women, transgender folks. I'm going to try to put together a nice little talk. So if you have friends who want information, and there's not a lot of information out there for those folks, we're going to try to put that together for them. Okay. What comes after the consultation after you've already done the testing? Is there another ultrasound being done just so a CNY can say they have been able to see the uterus as well? Well, really, it's just, and again, you're asking very specific questions, Deidre. If everything's ready, then yeah, you can jump into a cycle. But I don't like to tell people they're going to jump into a cycle, and because I don't know enough about them. So if everything's ready, you jump into a cycle. If everything's not ready, then you don't. Jessica, time frame between hubby's aspiration and when I can start stimulation for IVF? I don't know. Have all the testing been done? Has yeah, I mean, medications, timing, protocol. You could either freeze the sperm or you can actually do it fresh. It just depends on the urologist. So you stated about 3 appointments for donor IVF. What would that be within 1 week or you know what, Melanie? I talk to the nurses about the schedule. I'm giving you a general idea. What are the pros and cons of using fresh or donor user fresh versus donor eggs? Well, the pros and cons. Frozen eggs are already from a proven donor, so you know you're getting eggs. Whereas a fresh donor, you have no idea whether you're going to get eggs or not. Frozen eggs, these are quarantined for 6 months. Fresh, they could get COVID the day before, Zika the day of. No idea. So the fresh, if you go to a program that gives you all the eggs, you may get more eggs. With the frozen, you at least have a guarantee. How can I prevent ectopic pregnancy? Well, you can have your tubes removed, as sometimes that's necessary. I am from New Jersey. If I'm going to do in-house monitoring, how far in advance should I arrive for monitoring? Well, the whole cycle is 11 days of stim, so you want to be there at least those 11. Then if you're doing a fresh transfer, you want to be there for that. So you should be there for the first visit. What is embryo waste in reference to genetic testing? Is that an embryo that is ruined as part of the process of testing the embryo? Yeah, you can lose it in the biopsy, an embryo. You can lose it in the freeze. You can lose it in the thaw. So there's lots of places. It's called embryo wastage. It's just a term. Like we're wasting a good embryo by doing a procedure. Now, there's reasons to do the procedure, so it's not that it's a bad thing, but you have to calculate that in there. Diana, is there anything I should do to prepare for my transfer tomorrow? I hope you have a whole list of things you're doing. You know, all your vitamins, hormones, baby aspirin, estrogen, progesterone, medications, low carb dieting, acupuncture. Those are all the things you should do. And make sure you come in with a full bladder, okay? Do you think there's a higher success rate with frozen embryo transfer? It just depends, Deidre, on the woman and the timing and a variety of other things. Marlena, I'll also be traveling to Colorado from New Mexico. Okay. Maritza, I was informed from one of the nurses that once my sister does her egg retrieval, we had the option of doing fresh. So again, Maritza, we decided on fresh, as you mentioned, both have the same success rates. Yeah, again, I don't know your particular circumstances, so nor could I comment on them, since that's a HIPAA violation. So I don't know the answer to that. And I don't know, I'm assuming you're doing that in Colorado. Yeah, it's just a little too specific. I honestly can't give you an answer there. Definitely ask when you arrive, for sure. Okay, not seeing much stuff here. All righty. You're welcome. Do you recommend PRP treatment washed weeks in advance of frozen embryo transfers? Well, the purpose of the PRP, it's a subtle, esoteric, rarely used, novel, somewhat experimental treatment for improving endometrial lining. If there's a reason that you have a problem with your lining, it may help, but I think that's rare. If you're gonna do it, yes, you should do it once or twice before the transfer, at least. It is a cumulative effect, is what they say. It's a cumulative effect. Okay. What else do we have? That was Monica. Lots of hearts, thank you. I see that there. Hey Mag, this is Anna. I'm wondering if I can do 5.5 or 6 days of PIO prior transferring my embryos. Hi Mag. I'm wondering if I can do 5.5 or 6 days of PIO prior to transferring my embryos. Well, Anna, it's usually 6 days. That's what you should do approximately. Michael, if stats are 0, 100, then why do we do the AMH, FSH, and TSH? Because you don't know if you want to know how much medicine you need. You want to know what your relative chances are. So, for example, if you have an AMH of 0.1 and you have a 1% chance, or you have an AMH of 10 and you have a 50% chance, you kind of want to get a sense of that. But everything in life is success or failure. It's not that's me saying to you that the stats are only for you to compare treatments. Yeah. What is the reason someone may do an HCG wash and an intralipid infusion, Jenny? Well, the intralipid infusion is sort of anti-inflammatory. Monica, you're welcome. Anti-inflammatory because it's a fat emulsion, and of course we're saying high fat, moderate protein, low carbs are good. And an HCG wash is washing the uterine lining with HCG, which primes, or I'm sorry, I don't want to use that word. It should trigger a response by the endometrium to say, hey, I'm ready for pregnancy, or look at me, I'm pregnant. Let's get all the juiciness going and get everything ready. So that's the thoughts behind that, is that it upregulates the receptors, that it upregulates the receptors. That's kind of the thought. All right, you're welcome. So yes, Michael, it'll tell you how much medicine you may need to stimulate. It'll tell you how many times, for example, it'll take you to get pregnant. So, for example, if you have an AMH that's 1 and you're 30 years old, it might take you 3 or 4 IVF cycles to get a baby. Whereas if you have an AMH of 6 and you're 30 years old, it might take only 1 or 2 times to get enough eggs, to make enough embryos, to make enough normal embryos to make a baby. Anna, 6 days of PI prior to transfer or transfer embryos on the 6th day with CMY. I did this previously and had success with my son. Yeah, I think you're answering for somebody else. Yeah, 6. Yeah, that's the right thing to do, Anna. That's how it works, actually. Will a transfer still be done if my TSH is above 2.5, 2.8? Yes. It doesn't exactly have to be below, Marlena, 2.5. We just prefer that. That's just one of those preference things. But absolutely, there are so many folks who have intercourse and get babies without monitoring their thyroids. Gotta put some power on this thing. It's running out of power. Get that here. There we go. There, if I can. All righty. Oh, I hope that works. Okay, it's kind of like I got to get a different stand. The stand's not very good. All righty. No, it's nice to be below 2.5, Marlena, but that's not that specific. But if you talk to your doc, just, if it's 2.8 and it's been that way for a while, you may slightly increase the amount of thyroid medicine you're taking. Anyway, that would be an option there. Okay. Have you ever had success on the first try? Yes. AMH under 1? Yes, of course, Jessica. Just give me an egg, give me an embryo, and there's a good chance of success. The AMH is an indicator like a gas gauge, but that, how much gas is in your tank, but it says you got gas in your tank, so that means you can get from here to the baby. It lets you get there. So it's the egg that determines success, not the AMH level. The AMH level is just like an indicator. Hello, sir, on Instagram, Gual Hasta Fertilidad. Thank you for joining me. If you have a question, just throw it up on Instagram. Happy to answer it. Anna Johnson, correction. I did 5.5 days of PIO, then transferred on the 6th day. Is it okay to do this again? You did 5.5. I did a 5.5 days of PIO. That seems a little bit not enough. You should have another. Thank you, Jessica. I try to use analogies all the time so that it just makes sense. So I'm glad you like that analogy. So Anna, you're saying you had success. Yeah, do the same protocol. As long as you may be mistaken of what your protocol was, Anna, meaning really bring that information to the practice so we can review it. Christy, do I need to request ICSI or is it automatic? Well, Christy, we pretty much do ICSI on everyone. It's extremely rare that we do not do ICSI. And usually that's a long discussion because I don't understand why people wouldn't. So yeah, I would say pretty much ICSI is the standard that we do with everyone. It's included in the process. All righty, Key Niwachi. OBGYN stated I have a small intramural fibroid and he wasn't concerned. I agree. Yeah, if it's a small, less than 3 centimeter fibroid in the wall, shouldn't be a problem. Sylvia, what's the oldest you will treat using her own eggs? Anyone with an egg. I mean, if you got eggs, why wouldn't you treat them? So you can treat them at 30, you can treat them at 40, you can treat them at 50. As long as you have eggs, it's getting the egg that becomes the issue, not whether we'll treat them. We can give you medications, but if your body doesn't respond and get us eggs, I'm not quite sure what you're winning here. You're just spending a lot of money on something that may or may not get you a baby. The other part of it is an egg is not a baby. As we get older, the chance that that egg is chromosomally abnormal goes up dramatically after age 35. So the age thing is a matter of getting you one healthy baby. Amber, what makes estradiol continuously go up after fresh transfer instead of going down? You're taking, well, you're getting, you should be taking estrogen, Amber, and you're having it produced by the ovaries. So Anna, this is way too, you're constantly asking subtle questions. It's not a consult, so I can't really, I'd love to answer you, but it's just, I'm not, call your nurse, get online, do a portal message, and they should answer you. Amber, I just found out my recent cycle was messed up so bad that my body is going in the opposite direction. I don't even know what that means, Amber. Just found out my recent cycle was messed up so bad that my body's. You can't get messed up by fertility medicines because they're nothing more than natural hormones. There's no messed up. It's different. So fortunately, my Instagram looks like I'm running out of time. So guys, if it conks out in 45 seconds, it's because I started a little bit early on Instagram. And then catch me next week if you'd like to on Instagram, or come over to Facebook, okay? Hey, Meg. Hello from Syracuse. Hi there. Hope you're doing okay, my dear. Thank you for jumping on. Do you recommend PGT testing after the age of 35 because of the likelihood of abnormal eggs? Because of the data, yes, that's one, but also the data suggests that the 35 to 38-year-olds seem to benefit best for arbitrary testing. In other words, is Meg a nurse? I can't divulge people's I can't divulge people's professions here, I guess. Hold on a second, folks. Let me just get this done here. Okay. Amber, hi Amber. Okay. Do you recommend PGTA? Yeah, and then the other reason to do PGTA testing is for genetic diseases or for family balancing. Actually, chromosomal diseases, not genetic diseases. Chromosomes are genetics. Let me shut this off here. Get this out of the way. There we go. All right. Let that charge up. All right, we're gradually running out of time here. Let's see. Yeah, that estrogen going up and down, again, with an embryo transfer, you are and should be on hormones, estradiol and progesterone, and a variety of other changes that are going on in your body. I wouldn't read too much into that. And of course, if you get pregnant, you're going to see changes in your estrogen and progesterone also. Righty. Any other questions out there, my dear? Here's, that's plural. I think next week, Tuesday. Yeah, I think next week I might continue doing my insulin resistance talks. You're welcome, Jenny. My pleasure. I got a couple of fun things. One of my favorite. Let's see if I can quick show you this here because I just happen to love this slide here. Let me see. Share screen. Let's see if this screen comes up here. Yeah, this is one of my favorite slides here on the amount of carbohydrates to eat to stay in weight loss or keto and maintaining body fat. You know, so I might continue this next week because I started a little bit of a discussion on that. As I said before, I'm also going to be doing a talk on LGBT fertility. Let's see. What test do you recommend for someone that has a Down syndrome sister, PGTA or biopsy? Well, PGTA is you can't inherit Downs from another person. So, but to avoid transferring a Down syndrome embryo, you can do PGTA. Just find out I have a cyst on both ovaries. Well, it depends on the size of the cyst. Amber, my E2 is almost 5,000 as of yesterday, May 14th, 2000, and I'm 8 days post day 3. It was only 1,000. Yeah, please, I don't know why you're doing all these things. Don't worry about the estrogen. Just simply, Amber, you can't do anything about it. It's just check with the nurses if you're taking your medications correctly. Will Dr. V no longer be doing lives? I don't know why you're asking that. I had not heard anything like that. Ada, you're very, very welcome. So I think what I'll do is I'll sign off telling you all think fertile thoughts. The expression you have a 0 or 100% chance of success does not mean we shouldn't test. It really says to you, don't let the statistics keep you from trying. Really. Statistics, you know, there's liars and then there's statisticians. So don't take too much, don't worry too much, okay, about the numbers other than, do I want to use my eggs and are we willing to help? The answer is yes, we're willing to help. Happy Nagra, yes, you need either an HSG, SIS, or a hysteroscopy before IVF to make sure your uterus is okay. Anyway, everybody, thank you so much. Have a wonderful evening. Sure enjoy you guys. Take care. Bye-bye.